Look at your hand for a second. See that tiny black dot? It might look harmless, but inside your skin, a tiny parasite could be growing, laying eggs, and setting you up for a nasty infection. This is hand jigger infection, and trust me, ignoring it can be dangerous. Today, I'm breaking down what causes it, sharing real pictures, and most importantly, how you can treat and prevent it. So, let's get into it. First off, what exactly is a hand jigger? It all starts with a parasitic sand flea called Tunga penetrans. Unlike your average bug bite, this little invader burrows deep into your skin, especially on your hands. It grows, releases eggs and bacteria, and all the while, you might not even know what's happening. Hands are a hidden hotspot for jiggers, especially around your fingers, nail beds, and palms. Now, how do you spot a jigger infection early? At first, the signs are easy to miss. Just a small black dot, maybe some mild swelling or redness, and that's about it. No pain, no itching. Just a tight feeling on the skin. But as the infection grows, things get a lot worse. The swelling turns into a painful bump, sometimes oozing fluid. Your nails can deform. If bacteria get in, you're looking at a serious infection. Here's a tip. If you see a pimple that just won't heal, especially with a black center, think jiggers. Let's talk about what these actually look like. Imagine a close-up of a hand with a swollen red bump. In the middle, a black dot. That's the flea. Unlike pimples or allergic reactions, these don't get better with creams. In fact, they get worse, fast. So, how do you even get jiggers in your hand? Bare hands in contaminated soil or sand are a big risk. Cracked or dry skin makes it even easier for the flea to get in. Contact with infected animals, poor hygiene, and living in tropical environments all raise your risk. Kids, people who work with soil, and anyone with rough hands, be extra careful. Ignoring a hand jigger can turn a small problem into a nightmare. You could end up with a serious bacterial infection, abscesses, nail damage, and in rare cases, even tissue death or gangrene. A lot of people mistake it for a harmless pimple or rash and waste time on creams, when what they really need is medical help. Here's what you should do instead. Don't try to remove a jigger yourself. You could make the infection worse. Proper treatment means seeing a trained medical professional, getting the flea out safely, taking antibiotics if needed, and making sure your tetanus shots are up to date. Good wound care and hygiene are a must. Catch it early, and you'll recover fully. Wait too long, and complications can get serious. Prevention is way easier than treatment. Wear gloves when working with soil. Keep your hands moisturized to avoid cracks. Treat your pets for fleas, and stay on top of personal hygiene. Remember, a tiny black dot could hide a dangerous parasite. See swelling, black spots, or stubborn lesions? Don't wait. See a doctor right away. This is Has Medicera, bringing you medical facts that protect lives. Like, share, and subscribe for more videos that keep you and your loved ones safe.